Recording in progress.
All right. My name is Mary Alice Riley, and I am presenting on federal discrimination protections for transgender patients. So I'll be taking a look at policy related to this issue. To summary, the transgender population in the United States experiences disproportionately lower health outcomes than the cisgender population. So policy is a major way that our government and our advocates can try to close that health outcome gap. But as it stands, transgender population experiences higher rates of chronic health conditions, higher rates of health problems related to HIV/AIDS, substance use, mental illness, and sexual and physical violence. I particularly want to draw social workers' attention to substance use, mental illness, and sexual and physical violence or trauma because those are the types of patients we will be working with, and it is likely that we will interact with and engage with a transgender patient considering the disproportionate likelihood that they will have be struggling with one of those issues. And finally, transgender population experiences a higher prevalence and earlier onset of disability. So this is a high needs population, it's a vulnerable population, and we need our healthcare industry to be able to respond to that in an adequate and comprehensive way. Unfortunately, the transgender population, as a minority, as a vulnerable population, also experiences bias and discrimination in regards and inequalities to accessing health insurance and adequate health care. Uninsurance rates are high amongst transgender adults, and that's likely related to the fact that insurance is tied to employment in the United States, and transgender adults experience higher unemployment than cisgender adults. I we Research also shows that half of transgender adults have reported negative or discriminatory experiences with their healthcare providers. So if they do have insurance or if they manage to have the resources to see a healthcare provider, transgender folks are often experiencing discrimination and bias at the point of care, which is not a positive experience. That is not good treatment and probably contributes to the lower health outcomes that I referenced in the first slide. And that might be due to the fact that medical school curricula really lack information about treating LGBTQ people. Information is provided around work related to HIV, but LGBTQ people have experiences beyond contracting HIV and have health needs beyond HIV treatment. And our medical schools are not adequately preparing medical professionals to treat them. Similarly, we're in social school, we are behavioral health professionals, and in order for any of us to get adequate training around LGBTQ care, we would need to attend an elective course and an advanced course with an advanced elective course in order to receive that training. So behavioral health training is not much better than medical schools. And then the final point here is that 1 in 2 transgender adults have had insurers deny them coverage for gender affirming care. So this is a very specific type of care that would apply to transgender folks, and insurance doesn't cover it, which makes it unaffordable for many and accessible to many, despite the fact that gender affirming care, according to research, unequivocally improves health outcomes, mental health outcomes, and increases life expectancy for this population. So it would for insurance to be addressing those issues, you would think that would be covered. But bias and discrimination influences what insurance will cover, and that means that gender affirming care is very inaccessible to this population. So, when looking at the policy, the overall and overarching takeaway is that rights and protections for transgender people and transgender patients are at significant risk at the state and at the federal level. But one piece of policy that I pulled out in my paper was about Biden's executive order number 13988, which interacts with the Affordable Care Act. So the Affordable Care Act is a major piece of federal policy that impacts and influences the healthcare industry, right? And when it was created under the Obama administration, it did ensure protections for gay and transgender patients through the ACA. And when Trump came into office, he reversed those Obama era decisions, providing those protections to the LGBTQ community. And even when during his presidency, the Supreme Court ruled in favor of making LGBTQ individuals part of a federally protected class, meaning that the federal government would protect and litigate if any discrimination happens towards if there is a case of sex discrimination, and sex being defined as sexual orientation and gender identity. If there's a case of sex discrimination, the federal government would protect those rights and would protect and like push back at that discrimination. Trump's administration did not respond to that decision. They did not realign their policies to match that Supreme Court decision, and it took until Biden's presidency and the first day of his presidency for him to sign an executive order which would instruct all of the federal agencies to bring all of the regulations, guidance, and enforcement mechanisms in line with the judicial branch's decision to protect sexual orientation and gender identity minorities. So that was a huge piece of that was a huge law, an important law. Biden really signaled his allyship to the LGBTQ community. And the evidence shows that this executive order lacks capacity and resources for enforcement, and in the long term will serve as the weak safeguard for transgender rights. So we need additional legislation from all three federal branches to protect transgender folks and to protect LGBTQ people in general from further attacks on their rights and protections. What does capacity and resources look like? Well, the offices of civil rights within each federal agency need more funding. Advocates have been pushing the Biden administration to provide additional funding to the offices of civil rights in each federal agency so that they can investigate complaints of discrimination. And when it comes to transgender patients in the healthcare industry, that would apply to the Department of Health and Human Resources. The Department of Health and Human Resources also needs additional funding and support for their Office of Civil Rights to investigate complaints about transgender discrimination through healthcare. And in addition to that, the Department of Health and Human Resources announced a plan to protect those rights, but have not yet released a plan to do that. They announced their support of protecting those rights, but they have not yet released a plan to enforce these federal protections. Advocates say that advanced protections should be implemented within healthcare organizations, facilities, and providers that are treating marketplace Medicare and Medicaid patients. They are receiving federal money to treat those patients, and they should be given guidance, and they should be given resources in order to do so effectively. And the Department of Health and Human Resources also disperses an enormous amount of grants to those organizations, facilities, and providers. Those grants could include stipulations around protecting the rights and protections of transgender folks, providing guidance on how to do that, resources, enforcement mechanisms, and even cultural competency training so that providers could receive more training on how to provide culturally competent care. So beyond just capacity and resources, Biden's executive order doesn't really have the teeth to do what it says it will do. In addition to that, federal protections do not really address the state level or the private sector, and so his executive order is pretty weak when considering protections within the state and protections in the private sector that aren't federally funded insurance plans or federally funded healthcare centers. Additionally, the Supreme Court has a conservative majority. There is a real possibility that the Supreme Court could make a ruling that would threaten or overturn the Bostock versus Clayton County decision. And we don't know when that will happen, but it is possibly a temporary ruling. And then finally, Congress is working. So the final and third branch of our federal government is the congressional branch, right? The Equality Act is something that the House has been able to pass, and it is a bill that intends to shore up transgender protections in multiple settings, including healthcare, but it has not yet been passed by the Senate, and it needs to be passed by the Senate in order to be signed into law by the president. It remains to be seen what will happen after the midterm elections, if the Equality Act will go up for vote, and if it will be passed. But it would be really great for transgender patients if it did. So, in conclusion, my main analysis is that we really need the executive branch, the judicial branch, and the congressional branch all to align to enact the protections that Biden passed in his executive order. And we need all three branches to align so that there's actually stability and a greater incentive for the federal agencies to enact those protections, create the bureaucratic processes, create the enforcement mechanisms, dedicate real staff time and resources to pushing that into reality and pushing that into practice, both within their institutions and then on the ground at healthcare clinics and by providers and through insurance plans, at least the federally funded ones. Um, Finally, I would just throw in that additional funding and resources should be allocated to protect civil rights in general. Um, Office of Civil Rights, the offices of civil rights in our federal agencies should never be underfunded, and that would have the fact that they don't have enough resources to advocate for transgender rights means they probably don't have resources to advocate for other minorities, and that's a huge issue. And then finally, I would just say that as social workers, it's important for us to know that at the federal level, it is not that the federal government protects transgender people's rights and protections, and that is supposed to translate into their healthcare setting. And so when we're out there at workplaces, when we're out there with our colleagues and with our peers, it's important for us to be able to know that and to be able to say, like, discrimination and bias is not welcome here. This is a federally protected class, and we all need to figure out how to honor that in our practice. And I think that has been really useful for me to learn in this process is just like, okay, I'm very clear that the federal government says that this shouldn't be happening. And I can use that as a speaking point if it ever comes up in a future workplace or in classes or wherever. Finally, I think as social workers, we can seek out elective courses as in grad school, but we have ample opportunity once we graduate to seek out competency trainings for providing care to LGBTQ people and for providing care to transgender individuals. And I think that should be a priority for us as this is one of the more vulnerable populations in the United States at this time. And it's certainly a priority for me. And if anyone has any questions about that or has any questions about my presentation, just let me know. And I appreciate y'all joining me today. Thanks for listening, and I'm going to try and